Insulin will now be available not only as injection but also in powder form that can be inhaled. Generally, it is believed that lack of sufficient insulin in the body is the reason for diabetes. This is a mistake. Only type 1 diabetes patients, who are around 5 to 10%, are short or lack of insulin. Type 1 diabetes patients need to have insulin injections or inhaled insulin. 90 to 95% of the diabetes patients have normal or higher than normal levels of insulin. When insulin levels are normal or higher than normal, why is it that insulin injection or inhaled insulin is taken, resulting in even higher levels of insulin? Study shows that excess insulin in the blood can cause serious risk and multiple disease conditions. When health awareness is so high, why is it that such a wrong treatment approach continues? The reason for type 2 diabetes is not the lack of insulin, or on the contrary, it is caused by insulin resistance and hyperinsulinemia, which starts when insulin is not able to efficiently do its role in the body. Most medications taken for diabetes focus on making the pancreas produce more insulin to reduce the blood glucose level. Every type 2 diabetes patient should know the health problems and disease conditions that are caused by hyperinsulinemia or high insulin levels in the body. Every diabetic patient should definitely know if the insulin level in his or her body are absent or lower than normal, then it is type 1 diabetes, or if insulin level are normal or above normal, then it is type 2 diabetes. In the case of type 2 diabetes, we shall see how insulin effectiveness can be increased to achieve normal insulin and blood glucose levels and reverse diabetes type 2 and stop and avoid need for insulin injection or inhaled insulin and oral medications taken to increase insulin levels. We will also understand how this approach simultaneously avoids the risk associated with the increased levels of insulin, that is a non-risk factor for developing more disease conditions, making healthcare more risky and complex. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind the disease, measures for early detection, investigation to assess the impact of disease on different parts of the body, available treatment options in the modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medications should remember to reduce or stop medicines only under medical supervision. When we had to understand about the diabetes or the actions of insulin in detail, we should understand about the pancreas. We should have a knowledge about the pancreas. The pancreas has two functions. One is to assist the digestion. Next is to produce hormones. The digestion, it is making amylase, lipase, and that they are needed for the digestion of the carbohydrate and also the lipids, the fat we are eating. Next is the hormonal function. That is the major hormonal function is one is insulin production and another is the glucagon production. Insulin will reduce the glucose level, and glucagon will increase the glucose level when you are fasting or when you are doing work. It will increase it will keep increase means the body is want to keep it always in the normal range. Normal range, ideally the body will be able to function the best around 70 to 140. That is the ideal blood sugar level, which will be, it's always around 100 will be the ideal. Can go up to 140, but always keep it around 100 will be the ideal. Next is when you come to the diabetes. What is type 1 and type 2? Or what is the difference between the type 1 and type 2 diabetes? Type 1 diabetes means the production of insulin in your body is low. It can be because of usually starts at a young age, around very small children, around 3 to 4 years, and or it's slightly older children, like around 12 to 14 years. That is peak time you get autoimmune process for the pancreas to develop this type 1 diabetes. This autoimmune process, our own immune system is attacking the pancreas cells and destroying it. Usually, if the disease is diagnosed or when it is started within 2 years, whatever treatment currently, whatever medical treatment is taken, the pancreas function will be destroyed completely. That is what is seen. So, only thing the treatment is the support insulin can be given. That is the only treatment for the modern medicine which can offer. That is only replacing the hormone which is deficient. That's all. They have tried this autoimmune disease. Usually the immunosuppressants like steroids are given, but it is of no use. Within 1 to 2 years the pancreas will be, that is the study shows. But there is another method which is really effective, that is to correct the lifestyle. Actually this autoimmune disease and the type 2 diabetes also is a lifestyle disease, and we have to correct the lifestyle. That everyone is forgetting actually. Next, for the type 2 diabetes, and another thing for the type 1 diabetes is some disease which is creating problems, pseudopancreatitis, or the stones in the pancreatic duct, and doing a surgery on the pancreas and with removing the pancreatic tissue, and it can also lead to hypoinsulinemia and type 1 diabetes. There also we can do the need is hormone replacement, that is insulin replacement. Then for the type 2 diabetes, what is the problem? Here there is no deficiency of the hormone, and here basically the problem is insulin resistance. Insulin is not working properly. So it's a metabolic, insulin is a metabolic, it's very important for the metabolism of carbohydrate and protein. If it is not there, or if it is not working, it is a problem. Then what are the symptoms? When we come to the symptom, the hyperglycemia, that usually when we talk about the diabetes, we talk polyuria, polydipsia, and polyphagia. So you are very hungry, you are very thirsty and passing urine always. That is the sign of hyperglycemia, high insulin level. When the insulin level is 400, 500, 600, I have seen patients with 600 and all. But they will not be, they will be managing. I will wonder why when the 600 blood sugar, they are managing well. And in that case, definitely the hyperinsulin, because when they are tired, they think, or when they are, diabetic patients they cannot recognize between the thirst and the hunger. So they will think that because of the tiredness, more food. If they eat more food, they will become comfortable. But that is actually increasing the sugar, and when the sugar is increased, the body will try to remove it through the urine. That is the reason for these problems. But for that can happen usually with the type 1 diabetes, will be diagnosed in that stage, and also weight loss. In type 2 diabetes, the early sign is not this polyuria, polydipsia, or weight loss or anything. Actually, in the initial stage, the weight gain will be there. The weight gain is the one of the reason, that is the causative factor for the type 2 diabetes. Then what we will see is the darkening of the skin, face, and especially the neck. The darkening will be there. The children and all, we can see that obese children, or even overweight, if the family history is there, the overweight children with the darkening of the neck, you can take that it is pre-diabetic. The child is going to be pre-diabetic, and when the pre-diabetes comes, the cholesterol and triglyceride level also will be very high. So this darkening is called acanthosis nigricans. That can be in the axilla or even in the private parts, it will be there. Next is the skin tags. That is, insulin is a growth hormone like activity is there. So it is actually high, overgrowth of the skin, that is actually leading to skin tags also. Then even before the sugar level high, this polyuria, polydipsia, this vascular damage, that is creating, that is vascular, that is blood, this hyperinsulinemia and hyperglycemia, both the sugar and the insulin level is, they are flowing through the blood vessels. So it is damaging the blood vessels, and it is leading to nephropathy, retinopathy, and you can see this frothy urine, or burning sensation because of the neuropathy, like cramps, or the sensation loss, or the burning sensation. Those things also can appear. Only in a very later stage, when the sugar control is totally gone, the sugar level is 500, 600 or 400, that level only the weight reduction and this polyuria, polydipsia and all appear in the type 2 diabetes. Next, how can we diagnose type 2 diabetes? One is sugar, definitely, blood sugar, glucose level. But that has to be taken, it is always better to take it in the fasting sugar and also postprandial, I mean after food, around 1.5 hours after food. More importantly, the insulin level is the most important, because I had to distinguish between this type 1 and type 2 diabetes. Whether we are, what is the situation of the pancreas, we have to see. So, and also the blood sugar level will show only the immediate effects. So, ideally now the HbA1c is taken as it is easier for diagnosis of the diabetic level and the status. If the HbA1c is less than 5.7, you take it non-diabetic. 5.7 to 6.4 is pre-diabetes, and above 6.4 is diabetes if you take it. And blood glucose level, then HbA1c and insulin level to distinguish between the type 1 and type 2. Insulin will be low in the type 1 and high or normal in the type 2. And if the patient is taking insulin injection, the insulin test will not be that reliable, because external insulin also is there. So in that case, to assess the function of the pancreas, we have to check the C-peptide level. C-peptide is insulin is secreted as a pro-hormone, and one part is separated before it is get activated, and that level we can measure. That shows how much insulin is produced inside the body. If the C-peptide level is also in the normal range, you can be relaxed, because it is a type 2 diabetes only, and you can get out of it if you are willing to correct the lifestyle. Next, why this diabetes happens? What is the reason? Everyone, when they get a disease, they'll think of. And there is two factors for most of these diseases, especially this lifestyle diseases. All comes under lifestyle diseases. So the lifestyle is one factor, and also the genetics. We know that it runs in the family. If the one parent is diabetic, definitely there can be a chance, and if the two parents are diabetic, mostly the children will get. The extent will also depends on one or two, on how many family members, because it's a multiple factors, even the multiple genes are involved in this. And even if your father and mother is diabetic, if you lead a healthy lifestyle, you need not get diabetes. That is also, everyone should understand that. Oh, my father is having, so I am also going to get diabetes. Don't think like that. If I have seen the patients who are having father and mother diabetes, they are also got diabetes, but get out of it with the lifestyle correction. So it is possible you can come out of diabetes, especially for the type 2 diabetes, where the pancreas function is, at least basic function is there for the pancreas. Next, what are the co-morbidities? What are the associated diseases which can occur in a patient with diabetes? In type 1 or type 2 diabetes, both. In the type 1 diabetes, the major problem is the hypoinsulinemia and the hyperglycemia, hypoinsulinemia, and because the sugar is high, organ damage can occur. This kidney, liver, eyes, and neuropathy, all those symptoms. And also it's an autoimmune disease. They can get the other autoimmune diseases like thyroiditis, and again the cancer, because this because of the problem in the immunity, the cancer possibility also will be high. In type 2 diabetes patients, it's a part of the metabolic syndrome. If you get type 2 diabetes, there will be definitely overweight or obesity, excess fat will be there, and you will be having this dyslipidemia, or the triglyceride and cholesterol will be high. And if the cholesterol, it will be get deposited in the arteries, and the arteries and vessels will get damaged, and complications of the end organ damage like retinopathy, nephropathy, neuropathy, and things like that occur. And also this excess fat in the blood vessel. You need to take statin, the blood cholesterol level you can control, but the triglyceride level, the real fat, you will not be able to control with medication. For that you have to correct your lifestyle. You have to reduce the carbohydrate and fat intake. Then only you can correct the triglyceride level. So if the triglyceride level is high, it will be deposited inside there is no other place, so it will be deposited inside the blood vessels itself, and you get the heart block and coronary artery block, and you go for a stenting or a bypass surgery, or a heart attack or a stroke. And if it is depositing in the brain, the carotid artery which is supplying the brain, it can get stroke can occur. And above all, when a patient, if a patient or oneself is a patient with lifestyle disease like diabetes, he'll be always a complex patient, because if you get an infection like a COVID or a pneumonia or accident, an injury, then you will become a complex patient and the recovery will be compromised compared to a normal person which doesn't have any disease or a medication. Even if you are controlled with the medications, also you will be a complex patient, because all these medicines will interact also, and your immunity will be compromised. And the immunity, this hyperinsulinemia reduces the immunity. So hyperglycemia, they will give a very good atmosphere for the infections to flourish. And because of the immunity problems, you can get cancer, allergy, autoimmune diseases. You can watch the diabetic patients, they know that after years they will be adding on all these diseases one by one. These diseases will be coming in. And also your blood vessels are getting damaged. So all the organs, that is why the diabetes is a disease will affect all the organs, including the brain, and the dementia, irritability, anger, all this will be there. And it will fluctuate with the blood sugar level, hypoglycemia, hyperglycemia, and it will be always with the medicine. It will go hypo, and then it is when you are taking food, it will go hyper. So this will be affecting your mood and emotions and the psychological and cognitive factors also. Next is, what are the investigations if you have a diabetic patient or on a yearly checkup? What we have to check it? Definitely glucose you can check at home. Now continuous monitor which can be connected to your smartphone is available, or you can do the testing at home otherwise also. Then everyone should check the insulin level, and if you are on diabetic medication, you should see the C-peptide level. That is most important for your management actually. If you are type 2 diabetes, you can, if your pancreas is working properly, you can be relaxed. If you have a willingness, you can come out of the disease. Next, what you want to do is an ultrasound scan of the abdomen. It will show what is the situation of your pancreas, where the fatty infiltration is there in the pancreas. It's very common to see that fatty infiltration in the liver. Now with the very advanced ultrasound scans, you can see the pancreas also fatty infiltration in diabetic patient. And also there can be stones or some other problems. Even there can be hypertrophy or small cancerous changes, or because the diabetic patients, the pancreas cancer can occur, so that also we can check. And also the status of the kidney. Or next is to see what is the status of the heart because of the blood vessel damage. For that you can do ultrasound scanning of the echocardiography and also CIMT, that is the coronary carotid artery intima media thickness. That is the one major blood vessel is there in the neck. It is very superficial, and it can be checked for the fat deposit. And vascular aging, you can see that also, how much fat is depositing. It's a representation of all over the body. So almost 100 kilometers or 60,000 miles or 1 lakh kilometers of blood vessels are there in our body. And you can get a glimpse of that and assess the vascular aging you can do with that test. Next is liver and nerves. We can check the sensory nerve conduction studies. And usually next is another thing is the inflammatory markers and cardiac markers and nutritional parameters. Many of the patients will be having, even though they are overweight, they'll be having many deficiencies in the body, like vitamin D, B12, folic acid, and so many vitamins and minerals may be deficient also in deficiency also may be there in these patients. Next we will come to the treatment. What is the treatment? It's type 1 diabetes, very clear. If it is established and there is no insulin production, then you have to take the insulin injections. But if you are lucky enough to find out that type 1 diabetes in an early stage, and when there is insulin level and the C-peptide level is in a normal stage, you may be able to stop the progress of the disease not by medicine. There's no medicine available. Insulin is the only treatment, and it can only replace. But stopping the autoimmune process of destruction of the pancreas, you can correct the lifestyle. Especially this occurs in the children. So the junk food and the toxins inside that food is actually compromising their immunity, and there will be so many nutritional deficiencies will be there. Our body needs only, the immune system needs only the nutrients. And the toxins which is coming in the form of food additives, all the chocolates and pastries the children are eating, they will be containing so much of toxin, and actually that is actually creating the problem. If you stop and the correct lifestyle, then you may be able to halt the progress of the disease. That is one aspect. But if the pancreas is totally gone, then you can only replacement is the option. But I have experience with halting even the type 1 diabetes. Even it is, if the C-peptide level is ideally, it should be above 1.1, that is the normal range. But if at least the C-peptide level is 0.5 or 0.6, then you may be able to increase you may be able to repair and rebuild the pancreas of islet cell itself. Next, there is any option for the surgery in type 1 diabetes. We know that we are always thinking of this organ donation and transplant and all. That also has tried, but it is not of much use actually. It is all because after some time also it will recur. And also the transplant is not of much benefit actually. Because of this immunosuppressant use. And also another type of transplant is the islet cell transplant. That is separating the donor's islet cells and injecting into the liver, and this will locate in the liver and start producing. Here also the problem is the immunosuppressant use. So the immunosuppressant, then that itself is diabetogenic. That's the problem. So the type 2 diabetes, either you have to if it is an early stage, try to correct the lifestyle and try to prevent the progression of the disease. And once it is established, the pancreas is completely gone, the islet cells is completely gone, depend on the insulin injection. That also, it's always see that you are using the natural insulin. So now, actually, initially the medical fraternity and all the pharmaceutical firms are trying to make as much as normal to human insulin. So at a stage we are using the porcine insulin that is made from the pig, and then it was converted into one amino acid is different from the human. So we made the one amino acid corrected and made the normal human insulin. Then we started making it from the biotechnology using the E. coli or the yeast, and that also normal insulin. But after, I think in the 90s, 96 and all, the human analogs has come. Analog insulins. Actually, it is different. Then we started going back actually more till that we are going scientifically, and then you are back in the non-scientific way of modifying the insulin. Human insulin to some other things. That is because of so many interest in the industry and or patent and so many other factors. But the patient, you should understand is, all the studies shows that there is not much benefit for the analog insulin. It is maybe costlier, but not much benefit. It's always for the patient benefit. Let's go to the as much as natural insulin as much as possible, because you are taking it for the lifelong. Next is, what is the treatment for the type 2 diabetes? The conventional treatment, that is what is running currently, is start with some metformin or oral medication. Then it is, when it is not controlled, to go for insulin injection, and that is the conventional way of doing. But basically, any lifestyle disease, first line of management is lifestyle correction. You are not able to manage the lifestyle correctly. That is the reason for the doctors are giving you the medicines actually. So what you should understand, that all the medicines in there, whether it is insulin or the medication, most of them are actually increasing the insulin level. So anything is excess is toxin for the body. Even the hormone, even the glucose, when it's a nutrient, but if it is excess, it's a toxin. Triglyceride, it is a nutrient, but if it is excess, it is a toxin. And just like that, if the insulin is high also, it has so many side effects. Like if you are having a hyperthyroidism, thyroid hormone is high, as a part of the treatment, you will knock out the thyroid with the radioiodine, or remove the thyroid gland itself. But in diabetic patients, when there is excess insulin, you are injecting the insulin again. So that is wrong. Right? So basically, you are seeing the sugar control only. You are partially blinded and you are focusing only on the sugar. Why are you not looking into the insulin level? That is because when you are started this insulin and the current diabetic medications treatment for the diabetes, there was no distinction between type 1 and type 2. Because because the time understanding is not there. We don't know type, only there is diabetes and we have insulin, we are injecting, and then other medication come. We are not knowing how it is acting. Lack of knowledge was that time. But by the time the last 50 years, the treatment is established. Even the knowledge about what is happening is increased. But we are not applying in the medical field or in the practice field, we are not applying. That is the reason. So all this unscientific, basically the hyperglycemia is there, taking the insulin, and this it's basically it's a logically it is unscientific. Everyone for that you don't have to have MBBS or the MD or anything. Anything is excess high. One hormone is high and they are pumping again. That is against the law of the nature actually. So just to reduce, basically the treatment for the type 2 diabetes is simply lifestyle correction. You cut down your carbohydrate, not only carbohydrate, fat also, because the fat is the one creating insulin resistance. So you had to reduce the oil use and the nuts and the carbohydrate. Then what will you eat? Everyone will ask, if you can't eat rice, wheat and chapati, roti, rice, then what will you eat? So you can definitely, the lifestyle has changed. We are not doing much activity, so your calories should be reduced. But you should have all nutrients. So the energy, the nutrient-rich leafy vegetables, green vegetables and pulses or the fish or those who are taking non-vegetarian diet, they can have that also. So and also do some exercise to burn out the excess fat inside the body, which is creating the insulin resistance. That is the ideal treatment for this. And the other things actually, if you are taking, you are complicating, because you can see that if you are after starting the diabetic medication, you will be starting increasing the weight, and if you are not hypertensive, you will after some 2 or 3 years you will become hypertensive, and definitely your cholesterol and triglyceride will go up, and you will get a heart attack, or when you do a treadmill test there will be problems. Then you go for angioplasty, bypass and blood thinners and so many medications. And fatty liver will be there. There is not much medication for fatty liver, or the kidney failure, kidney GFR will go high, but there is not much medication. So that will be the situation. So the only treatment for correctly speaking, only treatment for the type 2 diabetes is the lifestyle correction. It has to be done by the patient. The doctor can only advise. And that understanding, every person should come into that stage. And then the 90% of the problem and the 90% of the diseases and medication and even the surgeries can be avoided. Next is the question, if someone is taking so many medicines, how can they come out of the medication? How can they do the diet, exercise? Because they may be very sick. And also if the person who is taking insulin, they cannot control their food, because when the insulin is taken, the hypoglycemia will come. So if you are on medication, it may not be easy to lifestyle correction. In that case, you have to take in help of an expert in correcting the lifestyle. That is where the role of the clinically supported lifestyle correction. In short, the common knowledge is that in diabetes patients, there is a shortage of insulin. This is true. Only 5 to 8% of the diabetic patients who are type 1 patients have this problem. Only this small group requires insulin injection, inhalers, etc. Second, in 90 to 95% of diabetic patients, it is not lack of insulin, but insulin resistance caused by insulin inaction that is the cause of diabetes. In this large percentage of diabetic patients, injecting or inhaling additional insulin and medications that increase insulin production in the pancreas increase the insulin levels in the blood, causing hyperinsulinemia. Hyperinsulinemia increases fat deposition in the body, increasing cholesterol and triglyceride in the blood, leading to atherosclerosis, blocks in the blood vessels, heart attack, stroke, fatty liver, and also impact the body's immune balance, leading to autoimmune disorders, cancers, kidney and liver diseases, etc. Third, modern studies show that an increased presence of insulin in the blood causes numerous health issues, including metabolic syndrome, cancers, dementia, etc. Fourth, most medications taken for type 2 diabetes focus on reducing blood sugar levels by making the pancreas produce more insulin. Every type 2 patient, diabetic patient should try to get a clear picture about the hyperinsulinemia or high insulin levels in the blood and the serious diseases conditions that are caused by it. Fifth, every diabetic patient should definitely find out the reason for his or her high blood sugar, whether it is insulin deficiency or insulin resistance with a normal or above normal insulin level, but is not functioning effectively in controlling blood sugar levels. Sixth, when lifestyle correction reduces insulin resistance, enhances insulin function, and help achieve normal levels of both glucose and insulin, it is not only possible to stop and avoid insulin injections, inhalers, or insulin releasing medications, etc., in type 2 diabetes, but also help to avoid the risk of hyperinsulinemia and associated disease conditions like obesity, hypertension, cardiovascular disease, liver and kidney problems, etc. Seventh, it is essential to remember that type 2 diabetes is a lifestyle disease and its real solution lies not in insulin injections, insulin inhalers, or insulin enhancing medication, but embarking on learning, identifying, correcting, and practicing an appropriate lifestyle to achieve a lasting solution. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulation can help achieve reversal of disease process, attain desired body composition and normalize blood parameters. Based on the patient parameters, efforts is directed to provide optimal nutrition, physical activity and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damage and come out of most of the medication within a month and avoid surgeries, provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Now we will look into a few case studies about the patients with the type 2 diabetes and what was the result. This is a 75-year-old lady. Her height is 148 centimeters and weight is 60.45. Okay. And her she's diabetic for the last 29 years and she's having hypertension and had undergone bypass surgery in 2006 and breast removal for CA breast in 2011. And she's on medication for so many diseases and hypothyroid. And she's having discomfort like varicose vein, leg edema. And all of the body, there is petechial hemorrhages. That is because she's taking on blood thinners. So she has so many bluish and black discoloration of the skin and muscle cramp, tension, irritability. And most of these diabetic patients, especially with this many diseases, definitely will be very irritated and depression and anxiety will be there. And she's on so many medicines. She's taking thyroid medicine, levothyroxine 50 milligram, and for the diabetes, dapagliflozin and tenagliptin, both morning, and Nextard 14 and 10 units in the morning and evening, and also Lipsa, that is also seraglutazole, that is diabetic medication, plus it is for the triglyceride also. And many medications like Metacard for the BP and metoprolol, another, and it's a combination actually. Metacard is a combination with the metoprolol and hydroxychloroquine for the BP. And for the CKD, this kidney, I don't know what is the, actually it is another thing, finasterone micronized, carnitine. That's another medication for the kidney. And this bedanicide and fluvoxostat, that is for the uric acid. Is so difficult to read all these medication names also. Azathioprine, that is for the hypertension. Atorvastatin for the cholesterol. And quinidipine, again for the BP. So this 75-year-old lady, you imagine all these medicines she has to take. Diplat is containing aspirin and clopidogrel. Both. That is the reason for she is having so much of vertical hemorrhages also. So it's a patient with a hypertension and 75 years. It's so dangerous to take such medicines because so much of this blood thinness, she can get a hemorrhagic stroke also. So that was the situation, and the result was actually she is having, when the blood testing, she was having so many vitamin deficiencies, B12, vitamin D, and even the iron deficiency was there. And her insulin level was so high, 35 was her insulin level, and C-peptide is also normal. She was taking insulin, so it can be because of the injection. So her C-peptide level is normal, that means she is having enough insulin which is produced. And her lipase and amylase values are also high. That means the chronic pancreatitis is there. So there is a risk of future developing this because of the chronic acute pancreatitis or the pancreatic cancer also. And another thing is her GFR is so low, which is 42 only, and the severe albuminuria is there. Calcium is low, microalbumin is 1800, more than 1800. And the HSCRP, that's the cardiac marker, is high, and the liver function, this thing is high. And even with the medicines, her TSH level is slightly high, just 6. So what was the result with the clinical supported lifestyle correction? We stopped all the diabetic medicines in the first day itself, and it was her HbA1c was 7.7 initially, and it was came down to 6.9 in the 8th day, and next 6.6 in the 15th day. By 30 days, her HbA1c came down to 5.8, and by 60 it is 5.2. And again it is maintained to 5.4 at the 90 days also. And the most importantly, that all the parameters has come down by the, everything is coming down in a progressive manner, and all the medicines were over by day 60. Actually, because so many medicines, usually by day 90 the medicines will be over, and by actually it is not delayed up to day 60. By day 45 the whole medicines was over. And usually most of the patients, we stop the medicines within, we will be able to stop the medicine within the 30 days itself. Because of so many medicines and this bypass surgery and so many complications, it is slightly delayed actually, and so many medicines. And what we'll see about her weight reduction also, she was only 148 centimeters, and by the 30 days, starting her weight was 60.8. By 30 days, it is 53.7. That is the result. Actually, she was able to reduce almost more than 10% within the first month itself. That is why this fast result also. And by 60 days, 51, and by 90 days, it is 49, and by 120 days, 46. And when she came, her body age was more than 80 and came down to 66. Her real age is 75. And she's feeling that also. And the GFR, the kidney function, was reduced, and it was 47, and by the day 60 it came up to 60. So that is the result. And even by 15th day itself, she was symptom free. Her major problem was edema on the leg and the pain and burning sensation and all. It was all gone. That is the result actually. They are trying all this 29 years. She was taking medicine. Now the medicine is over. She's come out of all the diseases, not only the diabetes, all the other comorbidities she has able to come out. We'll see one more patient. And this is a male whose age is 58 years and he's 170 centimeters and 83 kg. And he's on diabetes, hypertension and dyslipidemia medication for the last 5 years. And taking many medicines for the diabetes, that is tinagliptin and glymipex MF4 and glycomet GP2 and CTD 6.25 for the hypertension and Modalimab ASG, that is atorvastatin plus aspirin, and some multivitamin tablets and things. So then this patient here also, we stopped the diabetic medicines from the first day itself, and the other medicines for the slowly by BP medicine. His medicine was over, all the medicines were over the 15th day itself by then. And his actually complaint was his numbness of leg was the neuropathy, burning sensation and gastric issues was his problem. That is because of this blood thinning, this aspirin, and the gastric problem is because of the medication itself, and the burning sensation is because of the neuropathy and this even the hyperinsulinemia. And his also the insulin level was so high, 82.6, and blood sugar was 130 when at the beginning, and HbA1c was 6.8, and it has come down to 6.6 in the 8th day and 6.4 in the 15th day, and by 30 days his HbA1c 5.6, and by 60th day it was 5.2. So all the medicines is over by the 15th day, and without medicine his HbA1c is 5.2 in 60 days. So he has weight reduction. Actually he has 81.3 and it has come down to 76 in the 30th day itself. Actually by the 60th day also he is maintaining the same, because his problem is over. He just don't want to reduce his weight. Actually there are so many people who are very reluctant to reduce the weight. That is excess fat, they want to keep it, because there are in our part of the country, and so many will be complaining about the relatives, and the close relatives and friends will be discouraging them for weight reduction. Actually it is ideal for him he has to come down below 70, that is the maximum he can have, and ideally he should keep between 60 and 65. That will be ideal. So he had this SGPT, the fatty liver, and his scanning also was showing that the fatty liver and the prostate enlargement was there. That also the SGPT and the 50 by the first month itself, the end of the 30 days blood level, it has come down to the SGOT. It was 86 to come down to 26 actually. So if you are doing the lifestyle correction correctly, you can not only get out of the diabetes, all the metabolic syndrome and this associated problems you can come out. The symptomatically, blood parameters wise, and his HbA1c, you can blood sugar you can control within 24 hours itself. Usually by 12 hours, by the evening, it will be corrected. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving the circulation through optimal stimulation of whole cells by planned exercise. Third, minimizing toxins entering the body through food, water, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicine and 90% of the surgery can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that create the disease. This is why once the medication is started, very often both the disease and the medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging to do so by others. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from government service and in 1997 started practicing as consultant at Life Care Center, Thevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us human but also all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medication to protect our children, grandchildren and the coming generation from the ill effect of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on chronic lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle diseases. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in the lifestyle modulation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our YouTube healthcare channel. Thank you.